Good afternoon and welcome to Facebook Live here at CGH Medical Center. I'm Dr. Bill Bird, Chief Medical Officer here at CGH, and it's my pleasure to come to you today to talk about all things COVID. So, as always, our format is going to be, we're going to show you some facts, highlight some news in the past week that has come out, and then go into some analysis of that news and those facts. And then finally, I have a shout out I want to give here for one of our employees as well. So that's the plan. You ready? Well, let's go. Okay, first thing are some facts. And Matt, I'm gonna Matt put that up. So this is the thing we show most weeks. And on the left there, the red is this past week, and the blue is the week before that in terms of number of cases. And then on the right, that's 2-week numbers. So red is the last 2 weeks and blue is the 2 weeks prior to that. So yeah, pretty high numbers. And what else do we want to show everybody, Matt? Yeah. So you can see, at least in Whiteside County, the positivity rate's around 6.5% to 7%. And you can see the number of cases. And on the right there, the bottom right, that graph shows you how the cases are trending. So you can see the end of the peak last October, November, January at the beginning of that graph. You can see the peak that happened in the spring, kind of in the left middle of that graph. You can see the Delta surge that started sometime in like August or so on that graph. And then we were thinking it was going to trend down and be pretty mild, and now it's trending back up again in terms of those numbers. So there you go. That's where we stand right now as far as all that goes. Okay, and what else? Oh, I know. And Matt, do you know that Lee County thing? Would you show that too? So I thought this was interesting. One of our folks forwarded this to me. So you always wonder the cases, how many of them are vaccinated versus unvaccinated. Lee County keeps track of that. And so for last week, the 13th would have been like Monday or so. For that week, there were 208 positive cases in Lee County. And of the 208, 185 of those individuals were unvaccinated. And then it kind of goes into the number of cases based upon their age, which is very similar to ours. So Whiteside that I'm aware of, thanks, Matt. Whiteside that I'm aware of does not keep track of that, or at least may keep track, but they don't post those. Anyway, I would think that Whiteside would be pretty similar to Lee, which would be pretty similar to all the counties and all the country and all the world in terms of how those numbers tend to roll out. So I just want to share that fact with you. I wanted to talk about our region as well. So in our region, even though Whiteside County is about 7% in our region, which is Rockford, Freeport, up kind of in that northern area down to us and just a little bit south of us, our positivity rate in the region is more in the 9+% range. And of the patients that are hospitalized in our region, about 90% of the people that are hospitalized are unvaccinated as well. So that's some facts I wanted to share. And I think I had, I think I would call this under the facts part as well. So Illinois Department of Public Health puts out information on a regular basis. And as of yesterday, there were 3,614 patients in Illinois hospitalized with COVID, which is trending up. 759 were in ICU beds, and 382 of those patients were on ventilators. The state average for positivity is about 5.8%. And it's been 1 year since the vaccine's been available. So in that period of time in Illinois, approximately 18 million vaccinations have been given. This past week, the state has averaged giving out about 67,426 vaccines per day. So that beat continues to go on. I think those are the main numbers I wanted to share with you in terms of facts. Let me check those off, that we've done those. All right, now it's news time. So here it goes. Yeah, some sobering news. So COVID deaths have now exceeded 800,000 in our country alone. And our country tends to have a higher percentage than other places. Now you can quibble whether it's 800,000 or 750 or 850, but a lot of people. And a matter of fact, I thought this was worth sharing, was that 75% of those 800,000, about 600,000 of those individuals are over the age of 65. So about 1 in 100 people over the age of 65 have died of COVID in the past, well, since it all began here in our country. Now, if you're under 65, it's 1 in 1,400 have died of COVID. So this is what we've been talking about, that as you get older, your immune system doesn't work as well. And so that's why COVID is affecting those 65 plus far more than those who are younger. Which is different than 1918, 1919, when the vast majority of those affected were in the younger age category. So currently we're around 1,200 deaths per day in the U.S. For those over the age of 65, right now, other than heart disease and cancer, COVID is the third leading cause of deaths. 13% of the deaths in those over the age of 65 have been COVID since 2020. That's greater than diabetes, accidents, Alzheimer's disease, etc. And I know some would say, well, those folks who are older would have passed away anyhow. The numbers don't suggest that. Now, it's true that as you're older, the years of life expectancy are less. However, the numbers that I was looking at this week, 18% more older people, so those over the age of 65, 18% more died in 2020 than would be expected to pass away in an ordinary year, i.e., they passed away from COVID. And so, I don't know, I'm getting closer to 65, and I don't think like at 65, 70 that like my life that it depends, I guess, but I think there's still some good living to be had. So anyhow, I think that's just important to be aware of. So wanted to share that news. I'm going to check that off. So some information so Merck and Pfizer both are working and trying to get approval of oral pills for people who are symptomatic with COVID. And they may be trying to get indications, I can't remember, for people who have been exposed and are at higher risk. Anyhow, on the Merck side for the COVID pill, it's not going as smoothly, I would say, as the Pfizer side. There's some concerns about giving that to folks who are pregnant. They're still working through potential DNA changes with that particular medication. So the FDA approval is pending getting some of those questions, getting more information to those questions, which I'm going to break into opinion on that, which is a really good sign in that the FDA doesn't just approve things because someone presents something to them, and they do their due diligence on these kind of things before they go forward with them. So I think that's, first of all, a little bit of a step back in terms of the Merck pill, because that's the pill that would potentially be available sooner. But it's also a positive thing in terms of the FDA. News on the Pfizer COVID pill. So it doesn't have the same mechanism of action as the Merck pill. I think the thing, though, is that they're talking it may not be quite as readily available early on. I'm not sure what the time frame would be of that. But so far, at least, that Pfizer COVID pill, and I'm going to have it somewhere else, I think, in my news here. For so far, at least, when given to unvaccinated folks, that pill has reduced hospitalizations by 88%. And it also has a key protein that matches the Omicron variant. So there's hope in terms of how that pill might work for Omicron as well. So yeah, the Pfizer pill, still more to come on that, but the arrow is pointing up in terms of that being helpful, which would be really nice. And it's a 5-day window from when you get symptoms to when they recommend to start taking that pill. Okay, so wanted to talk a little bit about booster shots. So Pfizer it's a small sample study, but just so you know, they're doing some work with Omicron in Israel. And they had, I think, 20 people with booster shots, 20 people who were more than, I think, 5 to 6 months out from their second shot. And the boosters were pretty effective. I can't remember the numbers, but they were pretty effective in terms of preventing symptomatic disease and very effective in terms of preventing hospitalization. Just the 2-shot regimen and being more than 5 to 6 months out, they weren't that effective. So I'm going to break into my analysis and opinion. So once again, it makes good sense to go ahead and get boosted, because that's going to be helpful in terms of keeping you healthy. Okay, Omicron, a little bit more about that. Still, we're getting more of a picture, but it's not entirely clear yet. It does appear it's more infectious, about twice as infectious. And like in South Africa, in the US, I think from last week to this week, the percentage of Omicron cases went from 0.4% to 2.9%. So it's really ramping up pretty quick in terms of the number of cases of Omicron here in the US. And, folks smarter than me are their estimate is sometime in January even that the Omicron will have taken off enough to cause significant surges, because it appears to be more than doubling week over week. I mean, there are some places like down in Houston, one of the hospitals that I saw that I think 29% of their cases right now are the Omicron variant, and out in New York and New Jersey, about 13% of the cases of the analyzed specimens that they're doing for that are Omicron. So we know this from other variant situations. It'll continue to surge, and we obviously continue to still deal with Delta. And I will say, though, that so far, at least with Omicron, at least in South Africa, the number of people that have to be hospitalized are not as high. It's about 29% fewer hospitalizations. So then the question just becomes, where does Omicron fall in terms of how sick it makes you compared to Delta or some of these other variants versus the regular flu? Whereas, Delta and the other variants have been about 1% of the people that get sick with those pass away. For the regular flu, it's like 0.1%. So big difference in terms of, if you have big numbers of people, what that means in terms of the people who get really sick and die. So that's still kind of being worked out, but I thought that was news worth sharing. I did have a broadcast question that came up. It was a question about someone that I think, here we go. If a vaccinated with booster person comes in contact with someone who has tested positive for COVID, is it necessary to quarantine yourself? And if so, for how long? No, you don't need to quarantine. That's the nice thing also about being boosted. You can kind of go about your business. However, it is recommended about 3 days after exposure that you do a test to make sure that you're not asymptomatically infected. So that's the latest on that. So thanks for that question. I don't know who asked that question, but I thought that was a pretty good one. Okay. Yeah, so Emily, yes, he can get vaccinated. Last I saw, there is not a waiting period. However, your son does have some natural immunity now for at least 90 days. So prior to Omicron, I would say you'd have somewhere between 30 and 90 days from now, I would get your son vaccinated. I still would tend to hold to that in terms of what I'd recommend. That may change as we find more about Omicron, if it tends to infect people who have had Delta as well. Anyhow, for now, my number would be 30 to 90 days, but I have but anyhow, check and the health department may have even more information about that, Emily, in terms of what their recommendations are, as they may have a little more information about this Omicron variant. Yeah, but thank you for asking that, and I hope your son is doing well. Okay, then another piece of news. So this came out in Nature Medicine. This is good news too. So they did an analysis of there have been 38 million vaccinated people, and they compared them with folks who have had COVID infections in terms of the likelihood for the vaccinated people versus the naturally infected people to get what's called myocarditis or heart inflammation, or to have some type of irregular heartbeats. And yeah, it's pretty clear that it's more likely to occur if you get the natural infection than if you get vaccinated. So it's not that you couldn't get that if you're vaccinated, but once again, it's less likely than when you get vaccinated than when you're get a natural infection. So other piece of news that I think is still good, and that is still flu activity. So regular flu activity, it's here, but across the country, it is still low. So that's good, because we don't want to have another thing on top of Delta and Omicron that we're having to try to deal with. So yeah, that's more news to share. I think I have my news that I wanted to share for the week out. And and then I guess I will go into opinion/news on something. I want to talk about mental health again. So yeah, continues to be an issue for everyone. Nerves are frayed. This has been going on for a long time. Depression, anxiety, agitation, all those kind of things. If you're feeling that way, it's okay. If we've been through, as a society, we're going, this is not normal in terms of going through all this stuff that we're going through the last almost 2 years. So it can get to you, sure. And if it is, I'd encourage you to reach out to Sinnissippi Health Department both have counseling services and psychiatrists if needed. Reach out to your primary care physician. They also are very good at helping out and beginning the process of trying to help you do better and feel better in terms of your mental health. So I guess it's legitimate, it's happening, and my recommendation is, if you're feeling that way, seek help, get help for that, please. Other opinion related information. And I guess it would be, and I think this is my last opinion analysis part of our broadcast. So Matt, would you put up the arrow pointing up, arrow pointing down? Okay. So we show this every once in a while on our broadcast. It's our homegrown kind of explaining the situation. So, you obviously have natural immunity, which is people that get infected with COVID just because they get exposed and get sick. And that prevents further infections. And then you have vaccination, which helps to prevent further infections. And now vaccination, from this person's opinion, should include a booster to be fully vaccinated. And then you have, on the other side, you have variants, which we're dealing with now with a new one with Omicron. And by the way, the more people that get vaccinated, the less likely you have of developing more variants, which is a very nice thing. And then, of course, also there's, on the bottom part there is our behavior and how we go about living our lives. That also affects how many cases there are and how many people get sick. So right now, I'm going to say with this surge that the arrow is pointing towards variance and behavior winning. And we don't want that now, do we? So my opinion and recommendation would be, thanks, Matt, would be it's never too late to start the vaccination process if you haven't been vaccinated before, or to get boosted if you've already had the 2 vaccines. When you're indoors, wear a mask, unless you're eating or something like that. And then as best you can, distance even when you are indoors. Here's the deal on that. If you do those things, first of all, particularly if you're vaccinated, there's still a chance you can get sick, get symptomatic COVID. Obviously, it's about the ratio is about 90% to 10% right now. If you have been vaccinated versus unvaccinated versus vaccinated, but you still can. So it's not like it's going to keep you from getting it. But the more people that get vaccinated, the one thing it does help with is it helps, even for people who are vaccinated who do get sick, it flattens the surge. It flattens the spike in the surge. And that makes a big difference for those of us in healthcare who are taking care of those who get really sick and have to be hospitalized, because a surge that just kind of takes off is really tough to try to navigate. It's much tougher to try to navigate in a hospital as compared to a more slow up and slow down type of surge. So you have less chance of overwhelming the healthcare system if you have a slower surge, and that's where trying to do getting boosted, getting vaccinated in the first place, if you're indoors wearing a mask, can be really helpful in terms of protecting you, but also it's very helpful for our healthcare folks in terms of those surges. And just, I mean, in our region 1, as I was saying again, we have had a lot of hospitalizations for COVID in our region, particularly Rockford, Freeport, and even over at KSB, but we're starting to feel it more and more here at CGH as well, which would be expected, and we're not that far removed from all those folks. So, yeah, once again, I would just encourage folks to take those measures, and it can be really helpful. Our folks here at the hospital and all hospitals are doing a really nice job and doing our very best to take care of everybody who comes in here sick. That's our mission. That's what we do. It doesn't matter whatever your condition is, whether you've been vaccinated or not. It doesn't really matter. We're going to take good care of you. It doesn't. Yeah. But anyhow, my point is, it can be really helpful if you get vaccinated for yourself and for the healthcare folks to flatten that curve in terms of the number of people who show up all at once. Because there are issues with folks. Even nowadays, the hospitals are full enough, and I'm sure you've read this or seen this on the news, that it can be at times very difficult to get people even transferred who need other types of care too. So yeah, I'm going on and on. And one last thing on that analysis and opinion. I know there are folks who are still struggling with the idea of getting vaccinated. Okay, you're entitled to your opinion. I am not going to be. Anyhow, everyone's entitled to their opinion, but I would say that in the medical community, there are some folks who don't agree with the recommendations, but the vast, vast majority of folks in the medical community and scientific community are really comfortable with what I've been saying week after week. It is our best way to get through this. And you can go down past where you can read where we should be doing this or this, or we should let the natural immunity happen. I think that is not as good an idea. Yeah, that's an option, but there's a lot of people that get really sick and then don't make it in that process. And gosh, I just don't think that is the route that's we'll get through it that way. But I think it's the route that causes a lot more pain and suffering for everyone. And I just don't endorse that. And I do not think that the pathway of those who think that that's a really way to go pathway, it's a narrow path. And it's one that once again, the vast majority of folks who are trustworthy scientific folks would say, no, not a good fit. So I just wanted to say that. I did want to give a shout out. And there was a question here from Stacy. Hi, Stacy. I had a booster on Tuesday. I have cancer. They gave me a full dose booster. I have run fever, head body, etc. How long will these symptoms last? What's the day? Today is Thursday. Stacy, I bet you your symptoms will be gone. This is broad, but somewhere between now and Saturday morning. That would be my guess that they'll go away. It could last a little longer, but probably not. And hey, I'm glad you got your booster. Um, if you're getting cancer treatment, getting some type of chemotherapy, yeah, glad you're doing it. And I hope you do well. I wanted to give a shout out this week for our Employee of the Month. There you are. Hi, Danielle. There's Danielle Balsley. And Danielle works as a radiation technologist in our cardiac cath lab. I've known Danielle for quite a long time. When I was over at my office in Morrison, she would help out there some. And she is a great lady and does a great job here for us at the hospital. And we are glad to have her be the Employee of the Month. And if you're the Employee of the Month, this time of the year, it's a good thing too, because your parking spot is right next to a door that gets you right into the hospital. So when the weather gets bad, it's a good December, January, and February are the good Employee of the Month months in terms of getting into the hospital quickly. All right. So, hey, next week we're going to have this. Oh, Kathy wanted to say, what does it say, guys, for an unvaccinated person who comes in direct contact with a COVID positive person? I don't know. We'll find it and post it. Kathy, I don't want to take a guess. I have a pretty good idea. I think you're going to be quarantining for a period of time. Pretty sure on that, but we'll look up and post it. And I guarantee if you looked at the CDC's website, they'd have that too. But yeah, our crack folks, marketing department behind the scenes will get that posted on Facebook for you. I think it's quarantine though. Okay, anyhow, getting on to next week, Dr. Eric Coons is going to be subbing for me. And so he is someone who spends a lot of time and I think has good information and will get you up to date on what's the latest and happening with COVID next week, next Thursday. And then I'll be back the following Thursday to update you on the situation. So until then, hey, thank you so much for taking the time to listen. I hope you have a great week. We're getting close to the holidays, so since I won't be on next week, I wish you Merry Christmas, and I'll see you before New Year, though. But have a Merry Christmas, and until then, stay safe. Thank you for listening, and have a great week.